mark that we usually go with. So welcome to everybody that's here, and we're going to do a couple of introductions in just a moment. I did want to, just for our club notes, a couple of anniversaries. We've got Donna Litwin-Makey is now 9 years with the club. Sparky Leonard in total has 22 years, some of that previous to joining our club. And our anniversaries, other anniversaries were Paul Mayran and Monica Rambor had celebrated 3 years, and that was August 5, if you want to make a note, Paul. Just so
yeah,
you know. Okay. And Allison Story and Dan Davidson celebrating 7 years came up this week. And August 19, I think I mentioned last week, Karen Kirkwood White had a birthday, and Bruce was last week, August 18. So that covers that side of things. I'm going to first call on Tom McCarthy, if you'll introduce some of our guests that are with us here, please.
My pleasure, Mr. President. First of all, I would like to welcome Chaz Langford, and he's the fellow that some of you seem to think was his dad. But in any event, he is a very active member of the Access Open Minds National Youth Council and also the Access Open Minds Chatham-Kent Youth Advisory Committee. He is, and I have witnessed his performance as an MC and leading participant at the national and local level. And he certainly is an excellent representative of youth interest and advice. So let us welcome Chaz Langford to our meeting. The next person, who I'm not sure if she has arrived yet, but Rebecca Smythe or Rebecca Prince, are you with us, Rebecca?
Yes, I am, Tom.
Excellent. Rebecca is the manager of integrated services at Access Open Minds Chatham-Kent, and she is on a very important leave at the moment, which she may make a comment on, but still participating and delighted she can be with us. She graduated from St. Clair College in early childhood education and from the University of Windsor with a bachelor's degree in social work. First worked as a CMHA Chatham-Kent case manager, and then a clinical coordinator at Access Open Minds Chatham-Kent. And then finally, in the current title that I mentioned, Integrated Services Manager, has provided incredible creativity in building an amazing youth mental health service organization. So let us welcome Rebecca Smith with us. Our next visitor could not be with us today, unfortunately, and that's Lori Rosler, but she asked me to give her best regards. There was a family illness that got in the road of her ability to attend. She is with the Access Open Minds project as a family navigator, and also very active with the Sash Bear Foundation in the Family Connections program. A very active and helpful addition. The next person that I would like to mention, and I heard her voice a while ago, is Dr. Paula Rayom Zimmer, who is the Integrated Vice President of Mental Health and Addiction Services, Blue Water Health and Canadian Mental Health Association Lambton Kid. I hope I got that right, because Paula, you have more titles and more responsibilities than most groups of 3 or 4 people. She's known and respected. Okay. Paula is known and respected locally and provincially for her leadership expertise and passion for collaborative and cross-sectoral approaches to integrated mental health and addiction service delivery and system outcomes. Now, while her professional career began, and I actually met her back then, in nursing and inpatient psychiatric area, she's held various significant leadership roles related to mental health and addiction throughout her professional career. She is the Chatham-Kent site executive lead of Access Open Minds, the only site located in Ontario. And it's also an Ontario Youth Wellness Hub with funding from the Ministry of Health and Long-Term Care. She earned her doctorate in health administration from Central Michigan University with a research focus on transitional age youth mental health services. She's a lecturer for the Schulich School of Medicine and Dentistry Department of Psychiatry at the University of Western Ontario, and is an alumna of the University of Toronto Rotman Advanced Health Leadership Programs. And in her spare time, she joined us today, and we're delighted and are welcoming her. And then I have the pleasure of introducing a gentleman I've known for a few years, Dr. Ranjan Chandrazena. He is, I have to say this genuinely, a creative genius in the development of innovative psychiatric treatments and projects. Certainly a scientific director and principal investigator in many clinical trials research projects. He has served as chief of psychiatry, chief of medical staff. He's been a telemedicine award winner. I have had the privilege of attending one of those. He was one of the first in our province. Works with the Schulich School of Medicine. Back in 2007, with the creation of TNT, that is today, not tomorrow, early psychiatric intervention with the Chatham Rotary funding. Dr. C led development and ideas with the support of Chatham Rotary through a survey of 32 agencies that helped us to put in effect a program that led to our being invited to join in with the application along with Dr. Asha Kamala, which ended up in 2013 our being invited to be part of a pan-Canadian project transforming youth mental health services, and finally approved by the CIHR and the Graham Boeckh Foundation is the only site in Ontario, and that became the Access Open Mind Chatham-Kent Centre. This is very much due to the efforts and creativity of Dr. Chandrazena. He has been involved in a remarkable number of leadership roles provincially and nationally, and we welcome him to be with us today.
Thank you, Tom. If you can hear me, that's very kind of you. My claim to fame actually is that if you look behind me, I don't have a fake Zoom background. It's the real Lake Erie.
Thank you very kindly for including that in your visual. Now, I will be, Brett, when it's appropriate, introducing our presenting person today.
Yes, okay, we'll get there shortly.
Okay.
Thank you very much for those introductions. We're going to call on Barry Fraser to continue with additional.
Thanks, President Brett. I'm pleased that I see that Collier Smith is on the call here. Welcome, Collier. Collier is a past president of the Ann Arbor 300-member Rotary Club. It was, what, 2016 you were president, Collier?
Yes, that's
something
correct.
like that. And he's now Collier is an assistant, one of the 12 assistant governors for the district, and he covers the area, of course, in the Ann Arbor area. I'm really pleased that he is the district chair of the Mental Health Committee and doing an outstanding job there into his second year of leadership there. So so welcome on the call here, Collier. And are there other members of the your district membership committee that's on the call here that you identify?
I am representing our club of Ann Arbor only because we have our meeting the same time.
Okay, good. Welcome. Thank you.
And we also have Andrea. Andrea, where are you from?
Hi, thank you. I'm actually the Director of Communications and Fund Development with Canadian Mental Health Association in Lambton, Kent, and I'm actually in Sarnia today.
Okay, well, thank you very much for joining us. And one other from the Blenheim Club, current president, Ron Vanderhogen. Welcome to Ron. Ron and I have similar positions. We have both started out as presidents and now working ourselves through Zoom meetings and various things like that. So we're very happy to have such a wonderful group joining us, along with all of our regular Rotarians who are back. Welcome, Allison. I'm glad you were able to pop on and get some internet access here. I know, like many of us, this is, we joined Rotary and found out that they were doing these kind of things with mental health. For me, I've been in 10 years now, and when I came in, I got to learn about the Tom. So Tom Story and Tom McCarthy and all of the work that they were pushing forward. So it's just been something for the Chatham Rotary Club that I think is very key for us, and definitely something that, you know, it's not a one-time project. This is you get behind it and you just stay behind it forever. So
Brett, if
yes.
I just mention something, we also have the Kojiko URTV participating, and I should mention to them that we are recording this, so if they can use the recording, we could provide it to them.
We'll make access, and I think Eric was going to try to do some work with it as well. So we'll see. This is our first time for having them join us. I thought our speaker today, this would be an excellent opportunity. Kojiko can tweak things, and we always used to record all of our speakers with Kojiko, and then that would play 2 or 3 times through a week. And they may be able to tweak this and make it work as well. So with that involved, we've done our clubs and anniversaries. We are going to skip our happy moments, although with all of us, part of it we're going to skip it because we can't collect any money from anybody for this. So we're going to let that one slide, and I'm going to go back over to Tom McCarthy for to present our guest speaker today, please.
Thank you very much, Brett. It is my pleasure today to introduce our presenter. Ian Boeckh is the president and a director of the Graham Boeckh Foundation, a private family foundation. It was created by J. Anthony Boeckh and his family in 1990 and dedicated to transforming mental health services. Ian has led the foundation and the development of several multi-million-dollar partnerships with Canadian governments to develop integrated models of care for youth mental health, substance abuse, and related issues. These integrated models are now being scaled up across our country. The foundation also leads a number of collaborative initiatives to promote knowledge exchange and collaboration across the mental health sector in Canada and internationally. Today, Ian will speak about the foundation's work in youth mental health, particularly related to an emerging pan-Canadian movement called Integrated Youth Services, or IYS. Just remember that and engrave it into your brain. It's going to make a big difference. The foundation recently created a $10 million partnership with Bell to strengthen the movement. Chatham-Kent is one of the leaders in integrated youth services, due in part to significant support from Rotary. Today, we will discuss how the Rotary Club could provide additional leadership in this area. Ladies and gentlemen, please welcome from Montreal today, our presenter, Ian Boeckh.
Oops, sorry, I was on mute. Tom, thank you very much for that introduction, for inviting me to speak today. And I want to extend a warm thanks to all the Rotary Club members that are here today, and especially to the folks that have helped to build the integrated youth services in Chatham-Kent. You know, I had the pleasure of visiting Chatham-Kent. I guess it was maybe 4 or 5 years ago, and to the opening of the first hub. And I really enjoyed my stay and enjoyed getting to know a number of people in Rotary and others in Chatham. And so Tom asked me to kind of give a bit of background in terms of what's going on in youth mental health across the country and some of our work, as a way to kind of you know, provide some background for a discussion about what kind of leadership the Rotary could play in future in youth mental health. And so I've got a few slides that I will put up to kind of help you with this. So I'll just bring that up. Let's see here. Okay. I think I need to get on to there. That's better.
There we go.
Okay. Just a little bit of background on our foundation, my family's foundation. It's named after my brother who developed schizophrenia in his late teenage years, and he passed away in his early 20s from complications of his medication. And so my parents then, they realized many of the shortcomings of the services that were provided for people with mental health problems, and they decided to start a foundation to try and improve the system. And I'm fortunate now to be able to be leading our family foundation, which over the last several years has really focused on trying to build better youth mental health services, actually across Canada. And I guess, you know, our foundation has kind of been a pioneer in what I would say developing kind of collaborative philanthropy of working with other funders and particularly with various governments across Canada to be able to create large projects that build new models of care for youth and that can be scaled across various provinces. And so you'll see in what I talk about, you know, that our how we put into practice our philosophy of working with others. And we, you know, a while back, we realized that you know, mental health is a huge challenge. There are so many people that are affected. And if we don't work in collaboration with lots of other organizations and people, you know, we're not going to get very far. So just a bit of background for you. Some of you will know this, but you know, why do we focus on youth mental health? And I think this graph really demonstrates that. So in the yellow, this shows the burden of various sort of areas of disease across the lifespan. What you notice is that there's some diseases of kind of early childhood that decline, you know, till about 10 years old. And then once people start getting older, you get these kind of diseases of older age that we all know about. But in the middle is this bump for mental health, essentially. And you can see that around 10 years old, it really starts to build and reaches a peak in the early 20s and remains pretty large through you know, 30, 35 years old. And actually about 30 years ago, we didn't really know this. And what's happened is we've been able to measure the burden, and of course now a lot of people talk about mental illness, whereas they didn't before. So we're much more aware of it. And so what happened was that our healthcare system grew up focusing on physical illness, and the mental health system grew up in kind of a willy-nilly way and was kind of an afterthought, and as a result has been quite poorly organized. And we see this in many of the traditional kind of youth mental health services. So this is really what, I guess partly this realization led us to really focus on youth as a way that we could really make a difference in people's lives. And this slide just shows you a few statistics. Mental health problems are extremely prevalent. Many of you will have had you've had mental health problems, or I'm sure have family members or close friends. And 50% of mental disorders begin by the age of 14 and 75% by the age of 24. We've seen a dramatic rise in the number of people going to emergency rooms for mental health problems over the last decade or so. The same with hospital admissions. And part of this is driven by, I would say, a reduction in stigma, and more people are coming for help, which is really good. But we need to build the services so that they can get better. And then lastly, the last point is that I would say in the last probably 10 or 15 years, we've really been able to get conclusive evidence that, yes, intervening early is key to having better outcomes for people with mental health problems. And 20 or 30 years ago, that was not accepted at all, even though in many areas of health it's very accepted, such as in cardiovascular disease or cancer. Traditionally, there's been many failures of in the, I think many of you know that, very long wait times, fragmented services, difficulty in knowing where to get help. Particularly for youth, we've had this service cliff at 18 when people are supposed to switch over to the adult services, but as a result, many youth lose services altogether. The good news is that I think we've made tremendous progress in reducing stigma, and now the issues around mental illness are widely talked about. Mental health care has gotten up to one of the highest priorities, I would say, of society. It's discussed all the time in the media. Governments are working hard to improve services. So it's really a great time actually to be involved with trying to improve mental health services, because society is really receptive. So what has happened, I would say, well, over the last several years, is that a movement has emerged across Canada to specifically reform youth mental health services. And it just so happens that Chatham-Kent has emerged as one of the leading communities in this movement. And because a lot of the work of our foundation has centered on this, our kind of, become our fate of our foundation has been kind of intertwined with Chatham-Kent. And so what's happened is that some principles of what a good mental health services for youth have emerged, and models have emerged. And this is sort of all of this has been wrapped up in something called integrated youth services, which makes life a lot easier to reform the system, because trying to reform a complex system in a piecemeal way is very frustrating and ineffective. And so what integrated youth services does is it sort of wraps up a number of things that we need to do to provide good services into one kind of model. And here you see some of the basic principles that underlie integrated youth services. Youth and family involvement in the design of services and in the delivery of services. So the integration, so the various service providers working together to provide much better service to youth. Easily accessible points of care where you can get you can get very quick access to high quality services. Various online services, step care models, so different intensity of services for people with different needs. You know, I'm happy to say that a number of communities have really shown a dramatic improvement in services by implementing these principles. Dramatic decrease in wait times, much more accessible care, and the kind of care that really engages youth, and their services that youth want to use. So I think, you know, it's not an exaggeration to say that, you know, we're really, I think, on the cusp of a revolution in mental health services for youth. And here, this shows you some of the various types of services that are provided in, you know, what many of the communities are doing is building integrated service hubs, where a variety of service providers, of organizations provide, you know, many of the services that youth need. And the idea not to just focus on symptoms, but to really get people back into life and enable them to do the things that they want to do. So, and that's why we have services around employment and education, peer support, social services, primary care, substance use. And so it's really a holistic approach to getting people the services that they need. Now, I want to kind of give you an idea of some of the things that are going on across Canada. And this is a map that shows some things. It's a little bit complicated, but Access Open Minds was really what got this going. And those are the participating communities are in green. And there are Access Open Minds sites in a number of provinces, and that green dot right at the southern end of Ontario, I believe, is Chatham-Kent, and it's partly covered by another dot. And so, but after Access Open Minds, our foundation realized that to have really sustainable services, we had to really engage the provinces, because they're the ones that fund and really control the mental health care systems in Canada. And so what we did is we engaged some governments in the largest provinces to create projects very much based on Access Open Minds. And so now there are large projects in British Columbia. It's called Foundry. There's Youth Wellness Hubs Ontario, and in Quebec it's called Air Ouverte. And in Quebec and in BC, really the governments have recognized this work as being the provincial model, and so are scaling it up. Really, the intention is to the whole province. And we're still waiting on word for Ontario, but it looks very good that the government will start to scale it across the whole province. And, you know, there's so much momentum behind this work. Projects are just getting off the ground now in Alberta, in Manitoba, and in Newfoundland and Labrador. So we're starting to see, you know, pretty close to the whole Canadian landscape covered by these projects. And, you know, we can see a route to we hope, let's say, to have 300 communities, maybe in the next 10 years, have integrated youth services. And so one of the great things is that I think there's so much momentum that we know the way things are going in Canada. This is spreading across the whole country. And, you know, communities that don't have these services are asking for them. And so this is just a little more information on a couple of the provincial projects. I'm not sure whether you can see it, but on the left should be Foundry, a network of 19 sites, Youth Wellness Hubs Ontario, 10 sites. And one of the really innovative things in these provincial projects is branding. So there's a common brand and there's service standards. And as you can see on the left, what's happening is we're creating these really youth-friendly, attractive hubs. And branding is something that's often not used in health and social services. It's something that the private sector is very familiar with. And it's something that really helps to build a momentum for scaling up and also the sustainability. And so just as Tom mentioned, we recently developed a large partnership with Bell. And it's a $10 million partnership to develop integrated youth services across Canada. And really, the goal is to have projects in all the provinces and territories of Canada, and we hope have services, integrated youth services in every community across the country. And you know, Bell, many of you will know, has really done a lot of work to reduce stigma in mental health, which has been a tremendous success. And now they recognize that the big priority is to provide services for people. So just to conclude, I wanted to just briefly talk about what I think are some opportunities for Rotary. As I said, many communities are developing integrated youth services across Canada, and there's a whole bunch of others that are in various stages of thinking about developing them or trying to get organized. Just to give you an example, there are 10 community sites in Youth Wellness Hubs Ontario that have opened. Chatham-Kent is one of them. There are 15 other communities that are developing integrated service hubs. And there are some major projects underway. London has a very large multi-million-dollar project that's really ambitious. I think, as you probably know, I think Sarnia and Windsor are developing services, and Ottawa, and it goes on and on. And I think there could be a real, an important role for Rotary in helping the communities that aren't part of this yet, but you know, helping them to get organized and giving them some motivation and maybe some some idea of how to go about the process of engaging people around in their community on building better youth mental health services. And, you know, I think that the Rotary clubs in Chatham-Kent certainly have some great experience with that, and I think that would be welcome. I also want to talk a little bit about some opportunities that I guess you could say are international or global, because I know that the Rotary is a global organization. Just as we see Canada, Canadian communities and provinces getting organized and moving forward around youth mental health, there's tremendous interest and activity around the world, both in developed countries and in the lower income countries. And, but, you know, I would say, especially in the lower income countries, there's a real need for leadership and organization. And actually there's a large project going on with the World Economic Forum in terms of promoting models and methods for development of youth mental health services in the less developed countries. And I'd say is that, you know, the sort of the mothership of a lot of this activity actually comes from Australia. And there's an organization called Origin Youth Health in Melbourne that really has been a pioneer in this work and is really behind this World Economic Forum. And I think there is capacity, there's organization building, and I think there's some great partners that Rotary could work with, both in terms of developing youth mental health services across Canada and on a global basis. And, you know, I think that as well, just in terms of our foundation, we'd be very open to working with the Rotary and to support Rotary activities in any way we could. And you know, I think we're very fortunate in Canada that we have some fantastic leadership, and, you know, talked about your community of Chatham-Kent, but we have real global leaders as well that are involved with what's going on internationally. A number of our leaders in Canada are very involved in the World Economic Forum project. And so I look forward to, I hope, some future discussions about how we could work together. And that's all. I hope that's been helpful to you, and I'm very happy to answer any questions or just have you discuss some things about this opportunity. Thank you.
I'd like to open the floor to ask for questions. Going to ask Ian if you could either unshare your screen. I'm not sure how that's done, and then I can get a fuller view of everybody that's attending. And then I would ask you sort of to wave your hand at me, and I'll get you selected for any questions. And so we'll open the floor. I have to apologize because we're split over two screens here. Is there questions from anyone? If so, do a little hand waving and we'll get things started here. I was hoping there'd be one from Tom Story. And Tom, would you please go ahead?
Oh, well, I'm so glad I'm able to meet your hope, Brett. I don't really have a question for Ian, but Ian, I'd like you to know that I think it's the year after next, the incoming RI, Rotary International President, is a woman named Jennifer Jones, who is from Windsor. And we've got certainly Allison, but others, Barry, know Jennifer quite well. And certainly it's sort of a dream of mine to go beyond our own community. I wouldn't put that into the background ever, but I know Tom and I have often discussed this becoming a more of an international type of project for Rotary to embrace. And Tom, you may want to comment on where RAGME is right now. Have you heard much on that?
Unfortunately, RAGME, since the pandemic broke out, has been quite silent. I've had only one communication from them in the last 4 months.
Yeah, RAGME stands for Rotary Action Group regarding mental health. What's the I for? Mental something. Anyways, mental issues, maybe mental health issues. Initiative. Thank you.
I think so.
Anyways, just wanted to pass that along. Thanks, President Brett.
Thanks, Tom. Collier, please.
Thank you, Ian, for that very informative presentation. My question is, with the COVID-19 and the quarantine, how have you addressed? And then also, being from Ann Arbor, Michigan, in the United States, is mental health services part of the Canadian overall healthcare?
Sure. Okay. So maybe I'll answer the second question first. So yes, mental health is part of healthcare. And we have in theory, a comprehensive medical system that's provided for free to everybody. But traditionally, a lot of the mental health care that's been funded has been in hospitals and emergency related care. And one of the big gaps here is the psychological services that we're really trying to fill up. And I think there's been quite convincing evidence that psychological services are highly effective and even in many cases more cost effective than just pharmaceutical treatment. And so that's a significant gap, but yes, it is covered. And just so that, so COVID-19 and what's the impact on services, that's an interesting thing. And I think like many other parts of the healthcare system, the mental health care system scrambled very quickly when COVID hit. And a lot of services were given online, a lot by video chat. There's a number of other types of services, like there are some automated sort of self-help programs. And and this has really opened up an opportunity, because these types of services they were available to be implemented before, but they were very slow to be implemented. And this has given it a huge push. And so I think what's going to happen is from now on that youth and others are going to have a choice in terms of how they get their services. In particular, they're going to have this option to get them online or by video or internet chat. And so one of the things that we're trying to do is try to take advantage of this opportunity by supporting some of the development of online services. And I think that's an opportunity for the Rotary as well. And I think that crises, while there's obviously a lot of bad things are happening, they can also create some opportunity and can help break down barriers because of this sense of crisis. And I think these, with the online and alternative access is one of those opportunities that's really emerging. I don't know if that, does that answer your question? I think you're on mute. Yeah.
Thanks, Collier. Anyone else?
Yes, Brett, it's Barry here.
Yes, Barry.
Graham, you should know, first off, Graham,
Ian?
that Ian, that is an excellent video that Bell has put out regarding the topic we're discussing here today. Very professionally done. And Ian, you should also be aware that Collier, who just asked the question over in Ann Arbor, he spoke to our club about a month ago now about a very personal family history, where he shared with us the family's history and experiences with their son who committed suicide at age 23.
Mm-hmm. Yeah.
And that's why Collier has got so much passion relative to this topic.
It's Tom McCarthy. Just a little question. Two things. Do we have any linkage with the Origin program in Australia and Rotary? And if so, what would we learn from it?
Tom, is that question for me or?
Yes.
Okay. And so the question is, what are the links?
Yes.
With the Origin? Yes. So I would say that some of the leaders, what you see, the leaders in youth mental health in Canada have actually spent time working at Origin in Australia, and there's a lot of very good relationships between Canadians and Australians working in this area. And Canada has emerged over the last 5 years as really one of the leaders in the world in this area. And so our leaders are increasingly play an important role on the world stage, such as the World Economic Forum project that I mentioned. And our various leaders are working together as well. For example, there's a woman called Dr. Joanna Henderson, who is leading Youth Wellness Hubs Ontario. She and her team are sort of administratively housed at CAMH in Toronto, but she works with other leaders across the country and other people internationally. The same with in BC, Foundry is run by a fellow called Dr. Steve Mathias, and he's working across Canada and internationally. So it's there's a lot of people working together, and certainly we've developed a close relationship with the folks in Australia and Dr. Pat McGorry. Yeah.
Thank you, Ian. I have a note from Paula, if you can.
Yeah, thanks, Brett. I just want to make a few brief comments just to kind of add on to what Barry had commented and Collier. I think an important part of what we often present, and I know as we're really getting kind of the Sarnia-Lambton group in motion and hopefully replicating a successful model that we have in Chatham, is when we're reaching out now to our private sector, we're really talking to them about the impact of youth mental health on parents. And there's an excellent study from Children's Mental Health Ontario that was published in 2017 that identified $420 million in absenteeism for children in Ontario, for parents in Ontario for that year. And you know, it's just such a profound, we know the profound impact that it has on families, and I think that's a really important kind of thing piece of information for us to keep in mind, especially as we connect with private public, because it has a very profound impact on a workforce, on, that term presenteeism, you're there but not really there when your child is struggling with mental illness and you're watching your phone kind of for the next warning sign of something. So a really important kind of realization that is important, I think, to emphasize. And then the second one I want to, when Ian was just talking about Rotary and what they can do, I think that when we talked about the 14 sites across Canada and now the 10 sites in Ontario, there is no magic formula for starting up one of the Access Open Minds, and in fact, it's very grassroots. And so I can't emphasize enough that bringing like-minded, very motivated individuals together and the difference that we can make, because it's together and then creating the momentum, the awareness that strengthens your campaign. And I think that the Chatham site has so much, we've hosted tours, we've had the Guelph Rotary site, and just asking our peers throughout in our sector and our peers throughout Rotary is, what are you doing for youth mental health in your area? And then to share what we're doing. We've really learned from one another as a network. We just kind of leapfrog one another, and you come in here, and so I think that the importance of learning from a successful model. I think that Sarnia-Lambton, we're very engaged with the Mike Weir Foundation, and Mike Weir Foundation is very dialed in, very much because they've recognized the success of the Chatham-Kent model. So we just keep building that way, and I think Rotary has an excellent place to really be that kind of poster child, especially our Chatham team, who have been, the backbone of so much of our youth mental health success.
Thank you, Paula.
I think I could just say a few words.
Please.
Yeah, thanks a lot, Paula. I think I just want to echo what she says, is that having a successful model that people can see and learn about has tremendous value. The other thing is that we're looking at kind of the landscape of youth mental health funding across Canada. We work with some major partners that work at kind of a pan-Canadian and provincial scale, like Bell, like the Royal Bank, Medavie. But there's really, as far as I know, there isn't any organization that really works at the community level and reaches out to people in various communities and engages them and helps them to move forward. So I really think that there's an opportunity for Rotary to role that others would not be able to, and our foundation would not.
Ian? Any other questions, please?
I have one other one. It's
Yes,
I seem to recall, Ian, that earlier in your presentation you made some reference to developing youth mental health assistance and services in countries that have a much lower standard of living and different types of challenges. We are involved with a non-mental health area in another lower income place, and I'm just wondering if there are if you know of any examples of lower income countries where there are some successful initiatives in the mental health area working, because strictly from a personal standpoint, it'd be interesting, since we already have a relationship developed with this country, maybe we could do something to assist with mental health.
Sure. So yeah, I'm certainly not an expert in this area. I do know that it's not as well organized as in the developed world. but there are lots of different programs. You know, I know one of the approaches is to use technology, because a lot of people have cell phones, but also to use lay people. So to train people who aren't necessarily have a formal background, such as psychiatry or psychology, but that can be coached by professionals and can provide a lot of support. So there are definitely options. And I think what's happening is that the world is organizing, and the World Economic Forum, this project on youth mental health, they are developing consensus principles and models that can be applied. I think, though, that, you know, again, Rotary could play a very important role that organizations such as the World Economic Forum and Origin in Australia couldn't do. And I guess it's, you know, probably it's the case, you know, I know in mental health in Canada and elsewhere, we actually know what to do to make a difference. We know what can work. We don't know enough to be able to cure everyone, or to, you know, and some of the things are actually fairly simple to do, and it's just a matter of getting organized and helping people to implement it and make it easy. And a lot of this is not rocket science. You know, some other areas of disease, to, you know, in cancer, to significantly improve care, well, you'd have to spend a lot of money and develop probably new treatments and things like that. But in mental health, we have lots of things that we know work, but haven't been implemented. And that's, in a sense, is good, because that creates the opportunity.
Great.
Right.
Peter?
If I could just follow up on that. I think Tom was mentioning the work that we and some other clubs in our district are doing in northern remote Guatemala, where there's a medical clinic that's been set up in one of the villages, indigenous villages there, by another club in our group. And then we've been involved in putting Wi-Fi hotspots with large Wi-Fi servers in, hopefully by the time our projects are finished, in about 100 different schools. So the opportunities are there for, if there are mental health training modules that we can put on the servers that could be made available to the communities, because these hotspots are actually, they're in the school, but the Wi-Fi leaks out of the school. They're actually a resource for the whole community. Are there areas that we should be looking at here? That's a question for you, Ian.
Yes. You know, definitely. And I think, you know, I know of some projects, you know, the world's a very big place, but there are programs that, as I said, train essentially lay people. It could be nurses, it could be school teachers, it could be religious leaders, grandmothers, people like that, that have been shown to be highly effective. And again, it's a matter of, you know, it's not expensive. It's fairly straightforward, but it's a matter of, you know, I guess, getting organized and you know, figuring out, you know, what are the programs that have been developed that have shown good efficacy, and you know, applying them in the right way to the local circumstances. And I know that, you know, it's it's the same thing in Canada, that we have lots of different types of communities. We have lots of different ethnic groups, and sometimes it makes sense to have the services in a religious institution, if that's where people are comfortable and there's access, or in schools. And so I think so. And you know, one of the things that I would say as well is that we have the word integrated in integrated youth services because right now there's a lot of fragmentation that doesn't serve people well and isn't conducive to good services. And so I think one of the roles of a funder, such as, you know, our foundation or the Rotary, is to bring people together and try and develop common models and reduce the fragmentation, because, you know, mental health there's such a large group of people that are affected, that we need to think of how to do this at scale. And that's where, you know, some thought about building initiatives that can really be scaled is critical. And that's requires an organization that really can work across various communities, even various countries and jurisdictions. And that's certainly been the things that's helped us, because we've worked across provincial boundaries, which is something that many foundations don't do. And so we've been able to promote learning between provinces. We've been able to encourage collaboration. And I think that's really important, is to make sure that you're not incidentally creating fragmentation where you should be bringing people together.
Thank you, Ian. Last chance for any questions. I hadn't mentioned it earlier, but I'm going to ask, Allison, please.
Thanks, Brent. I just wanted to mention, to piggyback onto what Tom McCarthy had mentioned earlier, because 2 years ago when I was at the Toronto Rotary International Conference, which is a conference that happens all over a different place every year in the world, and tens of thousands of Rotarians attend this. It's a really important annual gathering, which unfortunately we didn't have this year, but due to the pandemic. But I attended the mental health action group meeting that they held 2 years ago. And when I described the Access Open Minds program and the Boeckh Foundation and our partnership, there was people from all over the world in this meeting, and they were so impressed by what everyone on our team was doing. And these are folks from Eastern Europe and Asia and Australia, all around the world, who were very much engaged with youth mental health specifically, and they were blown away by what we were doing. So to your point, Ian, and Tom McCarthy, perhaps I'm not sure, obviously with the pandemic things are a bit uncertain, but I'm assuming that the group is still in existence. And if there's a way we can link up that group who have connections all over the world to Rotary clubs in different sections of the globe, maybe we can start that conversation and help link up with clubs and districts around the world, because there certainly seemed to be a strong interest in staying informed and learning more about what we were doing. So hopefully we can maybe start making those connections. I'm not sure the first step, but maybe we could talk about that offline separately. But just to reinforce your point, Ian, that I think and hope Rotary can really have an impact there, and I know there's interest. It's probably just making those connections. So thanks for your presentation. Really appreciate it.
Okay.
Thank you, Allison. Bruce?
Just kind of a question for Ian, and it's kind of a personal nature. We've talked a lot about, or the conversation has a lot of been about engagement and models and so forth, and to me a little bit abstract, but very informative. My personal story is that I've suffered from depression since I was in high school, which was in the late 1970s, but it wasn't diagnosed till 1995. And one thing that happened is that I became a little bit resentful towards my parents for not recognizing that I might have been suffering from depression or anxiety or some other mental illness. And it was actually Dr. Chandrasena, who I'm under the care of now. He's the one who diagnosed it as a general anxiety disorder along with major depressive disorder. But my point is there any consideration for your foundation to, at the base level, to get the parents involved or the caregivers to diagnose the child who's going through puberty may be suffering from mental health issues, and that's at the base level. And in my case, I never really reconciled with either my parents because the resentment was so deep. They've since passed away, and I never had a chance to reconcile with them. But I often thought that if they had recognized that I had a mental health illness when I was in my teens, then I wouldn't be where I am today when in my early 60s, still dealing with depression. And I'm just wondering if your foundation is at that base level or not.
Yeah, okay. Well, thank you for sharing your story. I guess, you really showed that the need for trying to help people early on instead of, when they've been suffering for a long time, which I gather is often the case with people. And I know there's been people in my family as well. And, I think that's what these integrated youth services are really all about, is really trying to get people to come in, and even if it's for smaller problems, or even if it's for, help in getting a job. And then I think what enables us to do is to once you spend some time with them, then you look for what other issues there might be, and you can often pick up on them. But I'm a bit over my head here. I wonder, Paula, I think this is maybe something that you're better equipped to answer.
Well, I think that the family engagement piece is one of the key pillars of the Access Open Minds and the integrated youth services. We know that parents need education and awareness, and so that's definitely a target of ours, Bruce. And in fact, an important piece also is removing barriers so that youth themselves, when they're feeling, they don't have to wait till there's a crisis. We now have a front door that you walk into without a referral, that you can say, hey, can I talk to someone? So trying to remove barriers so youth can they can self-identify and reach out for the help themselves. But definitely, Lori Rosler is not here, who's our family lead at Access, but her role is specifically to engage families, to provide education, awareness, and understanding that families often are the key individuals who recognize the issue and bring the youth to help. So that's definitely a focus of the work we do.
Just to add one more piece to my story, the irony of the story is my mother was a registered nurse, and even with that background, at that time did not recognize or appreciate, or whatever you want to call it, that I might be suffering from mental health issues. Instead, I was just a rebellious teen in her eyes. So there's some irony there that she was in her end.
Thank you, Bruce. Okay, I think we've gone through all of our questions, unless there's any more hands that come up very quickly. I'm going to ask Tom McCarthy if he would just put a last thank you comment in there. Sorry, Tom, didn't give you any advance notice of this.
As a matter of fact, you did. You gave me a message and I tried to respond to you, but it didn't seem to go through.
Okay.
In any event, it's a privilege to offer the appreciation comment from our club and from the visitors today to Ian for sharing the thoughts he did, for creating a considerable amount of inspiration and providing some other pathways that we can pursue. I think in terms of the benefit to our organization is that it has opened a number of pathways that it is now our responsibility to examine and decide which of them we should pursue. And of course, the only way you can really make creativity work is to create some kind of incentive. And Ian, you have done that today by giving us some excellent examples, by showing something that I've known and dealing with you over the last several years, that not only do you have a lot of good ideas, but you listen. You pay a great deal of attention to what the issues are in front of you. And that is another gift that you have provided to us. So thank you very much for sharing your experience and your ideas, for pointing some direction. And the only thing I have to warn you about is we now know where you live. So there's a good possibility that as we develop our ideas, we'll be knocking on your door, perhaps with another Zoom. Thank you very much. Ladies and gentlemen, take your mutes off and applause online.
And I'd just like to say a quick thank you as well, Ian, for sure, for the presentation. That's great. Collier, thank you very much for what you're doing within the district. I know we're separated by currently a closed border. Hopefully that will open at some time and we'll be able to get together. I do like your haircut, by the way, and the last name's okay as well. Dr. Paula Riom Zimmer. I just have to mention that I was able to golf with your son yesterday, and he kept all the clubs in his bag. Nothing went in the pond. Chaz, thank you very much for coming out and spending an hour or so with us. I know we've had you before at the club, and we really appreciate and know that the family is well involved with our Rotary story.
Yeah, thank you for having me.
Thank you. Andrea, thank you so much. Hopefully things are going well in the Sarnia area with the CMHA. Rebecca, don't see you right now. I understand you're on a bit of a leave, so best of luck with that.
Thank you.
Dr. Chandrasena, hopefully you're enjoying a nice view out that thing. And we're going to ask Julia to do our closing with our thing, with our O Canada. And I'll just have you know ahead of time, if we keep Andy Watson on the line, you actually get to see a view of his backyard if he gets his iPad back online here. So Julia, if you would mind, please.
What is gallery view? Gallery view.
What's my view? That's a view.
Thank you all for attending. Hopefully we all got something out of that. I know I did for sure. So thanks very much.
Great. Thank you, everybody.